These instructions are only intended for patients under the care of Prosthetic and Orthotic Associates, headquartered in Middletown, New York. Please contact the helmet's prescribing physician with any concerns regarding your child's care. Welcome to Helmet Day. I know today is a big day and we are excited to be able to care for your little one. My name's Cassandra Delgado. I am the Director of Clinical Services here. We have an excellent cranial team that is really excited to help care for your little one. While we are in the back making adjustments to the helmet, it's very important that you listen to these instructions. We will come in throughout the course of these instructions and try the helmet back on to see what other changes need to be made. If at any point you need to pause this video, feel free to hit the pause button on the screen. We have given you a weaning in schedule for your baby to get used to the helmet. Following a weaning in period is very important to allow your baby's skin to gradually get used to the helmet, as well as for them to adjust their daily routine. It starts with day 1, in which you'll put the helmet on in 3 to 4 one-hour sessions throughout the day, making sure each session is about an hour apart. They're not going to sleep in the helmet for the first 2 days. So day 1, hour on, hour off, hour on, hour off, taking a couple breaks. Usually we say the first day no more than 4-hour periods broken up into 1-hour sessions. On day 2, we are going to go for 2 hours on, 1 hour off. 2 hours on, 1 hour off, repeating that a couple times again. Starting on day 3, we're going to make the jump and see if they can fall asleep with the helmet on. When a baby first sleeps in the helmet, they may need some time to adjust to a new sleeping position. So we might find them to be a little fussy for the first couple days. This is very normal. We say the first week is the toughest. So on day 3, if you only get a nap in, then that's okay. Try again a little bit more the next day. You are doing great. On the 4th day, that's when we really want to try to get them sleeping in it at night, as we do grow more during the nighttime. So we'd like to have them have more time in it, definitely at night. Again, for the first few nights of sleep, if they begin to fuss, try not to take the helmet off. Babies will learn, if I fuss about this and they take the helmet off, then the next time I fuss, they'll take the helmet off, right? So try to help soothe them to sleep to begin with so they can learn and get into this new routine a little bit easier. By day 5, your baby should be in the helmet pretty close to that full-time wear schedule of 23 hours. But as we all know, babies don't always follow schedules. So if it takes your baby 7-8 days to get up to that wear schedule, you are still doing great. Just as long as you keep going a little bit more each day, you guys will definitely get there. So again, we recommend a gradual increase over 5 days. This gradual increase is good for 2 reasons. One, it helps the baby temperature slowly get used to having something on their heads. They burn calories like crazy. You know your little one is always eating, always growing, so they run a little bit warmer. So we want to make sure that we gradually get their body temperature to acclimate, and so that we can check their skin also. And then this sample schedule is a sample schedule. Again, there might be things that come up where we have to deviate from this a little bit. We will go through any questions or concerns with you on that. So again, the goal is to be 23 hours of wear within about a week of getting the helmet. The exception is if there are any major skin irritations, major excessive redness, minor concerns like little movements of the helmet, we will address that at the first follow-up. So the helmet's not meant to be so tight on their head where it doesn't have a little wiggle room. The helmet should be able to move a little bit on them. But if you have any concerns, as always, we are here and we will definitely talk you through any, and if we need to make an adjustment, we'll make an adjustment. But typically that first week, we don't need any adjustments yet. Cleaning. It is so important to keep your baby's helmet clean. Your baby is going to stay much more comfortable and healthy in their helmet if it is clean. Sometimes before cleaning the helmet, Some caregivers know that their baby has more sensitive skin, and so we want to be very mindful to that sensitive skin. So the helmet should be removed every day to be cleaned. Most parents do this at bath time so that they wash baby and they wash the helmet at the same time. We want to use a washcloth just in this picture below, and whatever baby shampoo you're currently using to clean the inside of that helmet. You want to scrub that helmet good. If you start to notice yellowing in the helmet, that's the baby's dead skin cells sticking to that foam. This is where we'll get some of the odors that can occur in the helmet. So you really want to get as much of any yellowing off. You're going to see this the most on the forehead and the cheeks. So making sure you're getting any area that's having a lot of contact. You want to rinse out that washcloth, scrub the inside of the helmet, make sure all of the soapy residue is removed. You never want to submerge the helmet in a bucket of water or anything like that. Don't dunk it fully in water. Once the helmet has been cleaned, let it completely air dry. Don't use a hair dryer. You can put it in front of a cool fan if you need to help it dry off a little bit faster, but just air drying. It takes about an hour to dry. You may notice the strap on the side, that fabric is still a little bit wet. It's okay to put it on if the strap is a little bit damp, but the baby's head and the helmet should be completely dry before putting the helmet back on. If we put a wet helmet on, that's going to lead to a skin irritation and skin issue. Some babies do better when we disinfect the helmet also. So don't use an alcohol wipe. About 70% rubbing alcohol can go into the helmet first to get a good scrub and disinfect some of that bacteria that might have built up. And then after that, you're going to want to wash the helmet like normal. So it is okay to do the alcohol on the helmet. Just make sure that you are getting all of that alcohol residue back out. So we'll let a quick video play showing the helmets and how they are washed. So again, I have 70% alcohol here. I'm giving a good spritz inside this helmet, especially on that forehead and cheeks. And again, you're going to get just a washcloth and make sure you scrub all those areas really good. You're not going to hurt the foam. Some parents will also use a clean toothbrush to get in there a little bit more on some areas that might be difficult, but just this rag is totally fine to use, a clean rag, and make sure you're scrubbing nice and easy. This is going to help keep your baby's skin very clear. It's going to help the helmet not be so stinky to get that bacteria off. Then after that, what we're going to do next is just get a little bit of the shampoo that your baby's currently using and put that on a washcloth. We'll massage that washcloth and get it a little soapy sudsy so that we can then scrub on the inside of the helmet. Again, you never want to dunk the helmet into a bucket of water. Or into the sink. So you can see scrubbing the helmet really, really good, getting it nice and soapy sudsy. The main thing is we want to get out any of the yellowness that you're seeing, but we don't want to leave soap residue inside the helmet. So we'll keep watching the video. So getting it nice and cleaned out here, again, just being very thorough. This whole process should maybe take 2-3 minutes at the most. So I'm putting a little bit of water on my hands. You can run the water very lightly to rinse out any excess soap. Again, just a little trickle of water in there. If the helmet gets too much water on it, sometimes we've seen when patients have submerged the helmet, it can get mildewy. So we don't want that either, right? So just a little bit of water, enough to make sure that all the soap residue is completely out of the helmet. And then I'm taking a clean rag here and just wiping excess water off to help it dry a little bit quicker. You can also take a paper towel and wipe it down as well. And the main thing is to let this helmet air dry. Again, this should be done while your baby's getting a bath, while they're having their break in their wearing schedule, so that, you know, we have it on for 23 hours, we take it off to clean it, to wash the baby's head, and to let the helmet dry. The helmet's taking a little longer to dry. If it's a cold night or if there's a lot of humidity, it might take a little bit longer than an hour. That's okay. Make sure that helmet is all the way dry. Routine skin checks. Every time you take the helmet off your baby, it's important to look at their skin. When you look at their head, you're gonna see some redness. It's very common to see, especially on the high points where the helmet makes contact with the skin. So if we have plagiocephaly, a lot of times a forehead, one side of the forehead is more forward, so we're gonna see more redness on one forehead. If we have brachycephaly, where the back is flat and the sides are wide, we're gonna notice more redness on the sides. Very normal to see. Redness is a good thing. It lets us know that the baby's growing into the helmet and that the helmet is holding in the right places. Obviously, we don't want blisters. We don't want skin breakdown. So if the areas are a deep red, angry red, and they don't fade within about an hour or so, stop using the helmet and contact our office. So skin checks should be performed every time you take the helmet off. It's common, again, to see some pinkness, to see some redness, but that should start to fade. If you notice any that doesn't fade, reach out to our office. There will be contact information on the piece of paper that has all of this information on it that you're going to take home too. If you notice angry red, like a blister, or some bad skin irritation, stop wearing the helmet. It's okay. We'll get it situated to where they can get back into wearing the helmet. Sometimes a baby will have a rash versus a pressure point. A rash can occur if they're getting too hot or sweating. That will look like little pricklies. And so just making sure that you keep them nice and cool to prevent that irritation. Other times, if it's an area that looks very red and doesn't have a lot of pricklies, that's a contact point. So they're growing within the helmet. More redness shows oftentimes that it's growing. And so we want to make some modifications, but we don't want to offload that area too much because we know that it's holding to help improve the symmetry. No powder or anything should be put in between the baby and the helmet. For parents that have tried to put powder or anything into the helmet, it causes a yeast infection in the skin because it's a warm, moist environment. So definitely no powders in between the baby's head and the helmet. Occasionally, we will have parents use Aquaphor or some type of Vaseline on the skin. This is okay. This can just help prevent some irritations on that skin where we're having a lot of contact, especially for babies that have more sensitive skin. This is an important thing to kind of add to the routine. So just some simple Aquaphor or Vaseline can significantly help when we add it to the skin to keep it hydrated. So sweating and heat. This is probably one of our biggest concerns, especially in the summertime. So in the first couple weeks, your baby is going to be sweaty. You're going to take that helmet off and oh my goodness, they're going to be sweaty, especially on those babies that have a lot of hair. It's going to hold more moisture. And so after time though, their pores will acclimate. They will sweat less in that controlled environment as long as you're being consistent with the helmet. Especially during the first week and while your baby is getting used to the helmet and afterwards, dress them lightly, provide a fan or air conditioning in the room for hot days. If the heat is excessive or if you're in an environment where it's very hot, you may need to remove the helmet just temporarily. So again, very normal to see that sweat be pretty bad the first couple weeks until their internal thermostat is able to adjust. Some parents only just put them in a onesie. Again, keep them safe, but definitely keep them cooler dressed. You can definitely remove the helmet during times of like a diaper change just to wipe out some of the sweat and give them like a 5-minute break here and there to help increase their comfort. Using a fan in the baby's room or on the stroller is really important to help keep that air circulating and keep them cool. And let's say you guys are going to the park for a day or you're having an outdoor adventure, going on a walk, a sunny day, take the helmet off to avoid overheating and getting a skin rash. What I would hate is for the baby to wear it and they get really hot and then they have to be out of the helmet 3 or 4 days while it's healing, right? It would be better to take the helmet off for that hour, let them enjoy the family time, and then put it back on when they're not in that direct sunlight. And then that way they can keep wearing their helmet consistently rather than us getting a skin irritation for trying to wear it when it's way too hot outside and then them having to be out of the helmet for longer than we'd like. Do not leave the helmet in a hot car. This can make the helmet get warped, so just bring it inside with you. This is a good example of what it looks like when a baby gets a little too hot in their helmet, or if the helmet is dirty. It can cause these really red inflamed irritations. We want your baby to be comfortable, and so just being mindful of what can happen if they are getting too hot in there. If your baby's sick, if they have a fever, the flu, they're not feeling well, they're very fussy, definitely if they're running any type of fever, remove the helmet, leave it off until the fever has been gone for 24 hours. Now, let's say your baby's got a fever for a couple days. They might have grown between when we stopped wearing the helmet and when we're ready to put it back on. That's okay. Put the helmet back on when that fever's gone, and let's see how the fit is. Sometimes they've grown during that time, and we might need to adjust the helmet. And so put it back on, see if it looks tight, but the main thing is you will gradually need to get them used to it again. We'll need to get it into their habit. So you don't have to go as slow as when you went in the beginning, but definitely little bits at a time will be the most helpful for them. Physical therapy. A lot of babies that wear helmets have torticollis, where they need the neck muscles stretched out. So anytime you're doing those stretches or anytime they're going to physical therapy, make sure that you're removing the helmet so that it's not interfering with the range of motion stretches. Rashes, like we talked about before, if they get too hot in there or if the helmet's wet, it can definitely cause a heat rash to occur, especially in the first 2 weeks. So it will look like little prickly bumps on the skin. A thin layer of Vaseline and Aquaphor can help anywhere that might have high pressure to reduce any friction rash that might be in the helmet. Most of the time this is going to be on the cheeks that we'll see it, and on the forehead that's more forward, that is in more contact with the helmet. Again, if there's an area of deep redness, we want to see it start to fade. It doesn't have to be gone all the way, but we should see the areas of redness start to fade after about an hour. Every skin is different for different individuals. So lighter complexions stay red for longer, whereas darker complexions, we look for more darkening rather than reddening. And so each baby's skin is different. You know your baby. And so if your baby is prone to very sensitive skin or skin that turns red very easily, keep that in mind, that they may need a little bit longer than the 60 minutes to be able to give them the time that they need to let that redness go away. If your baby's getting too hot, again, they're going to get a heat rash in there. So periodically taking the helmet off for little breaks, diaper changes is the perfect time to do it. Or maybe when you give them a bottle so that you can have some snuggle time with having the helmet off and feeding them. Or for those mothers that are nursing, sometimes taking the helmet off during nursing can be a little bit more comfortable, and it gives the baby some time to have a break from the sweat. Not all babies sweat bad, so every child is a little bit different. So you may say, hey, I didn't really notice bad sweating, and that's okay too. So consistency is the main thing for the baby, and trying to do the same routine every day is going to help them be the most successful. So this is a good example of what heat rash looks like. You can see the little pricklies on the forehead. When a child gets itchy in there, those little fingernails that they have can be very sharp. So just be mindful when you take the helmet off, if they've got maybe some itchiness to their head, they may try to scratch their head. So you can see on the forehead we have pricklies on one side and almost little scratch marks on the other from the baby trying to scratch the head. So if you take the helmet off and you notice that the baby's trying to scratch their head a lot, you're worried about their nails cutting their skin, take a damp washcloth, cool washcloth, and just kind of massage their head for them, scratch their head for them so they don't have that urge to scratch it themselves. It'll also help kind of clean out some of the sweat that's in the pores and just kind of help soothe them a little bit. But this is also a sign that they need to be kept a little bit cooler. Helmet fit. So the helmet should be able to move a little bit on their head. It should be able to go up and down just a little bit and tip forward and back and rotate a little as well. It should not be so tight where it's not a little bit of movement. You may notice that the helmet is going to move throughout the day. This is very normal to have happen, and you may need to readjust the helmet throughout the course of the day, maybe once or twice, just if you notice that it's kind of moving on them. When babies lay on their back, that's when the helmet is almost pinned between the bed and the baby, and so that's when we'll see more of the helmet shifting. So when you lay the baby on their back, if you notice that the helmet is tilting forward on them and closer to their eyes, that's typical to see just based off the positioning. If your baby has an ear shift, which many do that have plagiocephaly, one ear is more forward than the other ear is. And so we want to try to stop that ear from drifting more forward. And so we're going to leave that helmet closer to the front of that ear so that we can help give a little bit of correction. So if your baby's helmet is touching the front part of their ear, that is okay, as long as we are not having lasting redness that is irritating their skin. Most of the time that front part is just touching the soft foam and not the hard plastic, and so it's usually fine. We very rarely have any issues with it touching the front of the ear, but if you see it touching, again, very normal to have happen. The other thing is, when you put something that is cut symmetrically onto a baby that's not symmetrical, it will look off at times. So you may notice that the helmet doesn't look perfectly even on their face. That's on purpose. It's so that we can correct the asymmetry. So the look and fit of the helmet will change over time as the baby grows and changes too, and as we shave down the inside of the helmet to make room for growing. So this is a great example of how the ear that is shifted forward is going to be in more contact with the helmet, and it's very typical to see. So as your baby grows, the helmet will need to grow with them, and they will need an adjustment. How do you know if you need an adjustment? If there's redness lasting and does not fade, if you notice the helmet's becoming very tight, if you notice the helmet really fitting differently, or if the baby's been out of the helmet for a few days or a week, that's okay. Just let us know, and we can definitely modify the helmet as much as we can to get them back to wearing it again. We have something called the winking eyebrow or the angry eyebrow. This is just a fun name for when we see one eyebrow that looks a little bit down in a helmet, just like this picture. This is from the forehead on that side. So if we look at this picture of the baby, the left eye in the picture looks a little bit furrowed down, right? So that baby's left forehead is more prominent, and the helmet is holding there nice and firm to help the facial asymmetry even out. It kind of makes the baby look like they're winking. This is common to see. It does not cause any harm or damage to the baby. It's just from some of the skin sticking inside the helmet, and then when they go to raise their eyebrows back up, because we're holding that frontal bone firmly, it's just not allowing the skin to pass underneath there. So a couple things you can do. You can loosen the strap just a little bit to help open up that helmet, or you can put a thin layer of Aquaphor in there just to allow that skin to glide a little easier. That's typically what we see fixes it right up. It could also be an indicator that they're sweating in there pretty bad and that they can't get that skin to move underneath the helmet. So not a concern when we see this, very common to see this, but we can alleviate it by loosening the strap just a little bit or putting some Aquaphor on that area just so the skin can glide underneath the helmet a little bit easier. Best practices: clean this helmet every day. Your baby's going to do so much better if they're going into a nice, fresh, clean helmet. And just making sure that you're really getting it good and not letting it yellow too much. The prescribed wear time is 22 to 23 hours a day. Consistency is key. For our families that can stick to this as much as possible, we really have the great outcomes in the shortest amount of time. And so it's really great when the baby's able to wear it consistently and they have a really good set routine. The helmet is safe to wear in a car seat only if the car seat still fits the child appropriately. Make sure to remove any pillows or cushions that would impede them being able to move their head and neck around. When in doubt, remove the helmet. If there is any slight concern about them not sitting in the car seat safely, the helmet should absolutely be removed in that event. Most of the time, the babies aren't spending all day in a car seat, and so there's typically not a concern there about having to take the helmet off for a very long period of time. Most car rides aren't more than an hour with a baby, so just making sure that you're traveling with them safely is the priority. Again, if your baby's been out of the helmet, let's say they got sick for a week or so and just weren't feeling good at all, definitely let our office know so that we can adjust the helmet and we'll gradually get the baby used to wearing the helmet again. Do not send them to daycare with the helmet for the first couple of days. Use the helmet at home for a few days after they are used to the helmet. Then you can start to send with daycare. Make sure there is someone at daycare that feels confident putting the helmet on and taking the helmet off just in the event of an emergency, or sometimes we have spit up and then we need to take the helmet off to change their clothes, right? And so making sure that there's a caregiver there that understands how to take the helmet on and off will be very helpful. I usually recommend that whatever day the parents get the helmet to work with the baby at night for wearing it or whenever they're picked up from daycare. And then as the weekend comes, try over the weekend to have them wear it for those longer periods of time. Or also some parents will start getting them used to sleeping in the helmet first and then continue wearing it throughout the day. And that's another good way to get them used to it. So for follow-ups, today we are going to schedule 2 appointments at your checkout. In 1 week, we're going to give you a call and just say, hey, how are you guys doing? Are you hanging in there? What questions, what concerns do you have? Let's talk about them. And then we will see the baby 1 month from that appointment as well. And so we will see if they've done any growing. We will check their progress and see if we have noticed any changes. Sometimes we see changes within the first month, but typically it's after month 2, 3 of wearing the helmet when we really notice if there have been any changes. So the main thing with that first month is to see if we need to trim anything or make any adjustments. At each appointment, we'll take some measurements just to track their progress and see how we're doing and have a conversation about how much longer we still need to wear the helmet. Again, we can't predict how fast your baby will grow, so the improvement with the helmet is completely dependent on the baby wearing it and how quickly they are growing. So the faster they grow, the faster they mold into the helmet, and then there's some that take their time getting into the helmet. So we will just keep an eye on them and track their progress, and then you guys just communicate to us any concerns you have with the helmet or anything like that. If there's some redness or a concern, we'll always see the child sooner, but typically a 1 visit every month is very standard for the large majority of our patients. Again, we'll check those measurements. We'll see if there's any growth. If there's growth, then we should see some improvements if they've been wearing the helmet full time. And then typically a lot of parents ask, how long do I expect the baby to wear it? Anywhere between 3 and 6 months. Again, it is based on their growth. The older the babies are, it will take longer. So if your baby is 9, 10, 11 months old, I would expect to see them wear the helmet for more a 5-month time frame. If your baby's on the younger side, 4 helmets, 6, 7, 8 months, then we could probably expect to see good improvements in another 3 to 4 month time frame. But again, these are just averages. Every baby is really different. So we'll keep track at every appointment and we'll say, okay, this was where we started. This is our goal. How close are we to that goal? Okay, we've gotten 2 points closer this month. Awesome. Let's see if we can get another 2 points this next month and really get that diagonal asymmetry down, or really get that cephalic ratio improved. And so that's what we'll keep track of. Not every month do we see changes. So some babies, we will go a month and we'll see them back and their head circumference hasn't changed. They just haven't grown in their head that month, which is very normal to see. And so we keep going on and we want them to continue to grow with their helmet, and we will hopefully see more improvements the next month. So at checkout today, you will sign for 2 things. One states that you received the helmet today, and the other states that you listened to these instructions fully and received a copy of them, and we went over them as well. If you have any questions, you are more than welcome to always ask us. You will receive copies of these as well. And if there's anything we can do to help this process, we are a team that is here and dedicated to taking care of your little one. Thanks so much for watching. Feel free to share this link with families, friends, and caregivers that are helping you with your baby, and we look forward to seeing you at your next follow-up. Thanks so much. Bye.